Botox is, the full name is botulinum toxin, and what we use here in Kenya is botulinum toxin A, and it's a toxin that is produced from a bacteria known as Clostridium botulinum, and it has several types, serotypes 1 to 7. It's been used since 1978, it's FDA approved, and it's a versatile drug that is used that can be used almost in all medical specialties. In ENT, we use Botox. We can use Botox in the larynx. Patients who present with hoarseness of voice as a result of vocal cord granulomas, we can inject Botox so that the voice comes back. With the vocal cord granulomas, when they are excised, we always tell the patient that they recur again. So Botox, they can go through surgery to remove the granuloma, and then after surgery, Botox is injected so that then we stop the contraction of the tissues and we reduce the recurrence. It can also be used in patients who have vocal cord, they have spasms. So as they're speaking, they start speaking with forceful voices. Their voices can disappear because of the spasm. So the Botox is injected in the muscles around the neck. Again, in the larynx, we can use Botox in patients who stutter, so that then they're able to say fluent sentences without breaks as they're speaking. In puberty, sometimes the voice can be abnormal, especially in the males, where they get abnormally high-pitched sounds as they're speaking, and that can worsen, can affect their self-esteem. So in such males, we can use Botox to just bring the pitch a bit lower and appropriate for their age. Botox can also be used in patients with migraines, chronic migraines, and that means that you're getting headaches more than 15 days in a month. Then Botox will be helpful. And what we do is that we inject the Botox along the nerve fibers that cause migraines to inhibit the production of the chemicals which are released when you're having pain. So the Botox can be injected around the forehead area, at the back of the ear, or at the back of the neck, in that region where the headaches are occurring. Botox can also be used in patients who have what is called Frey syndrome. Frey syndrome is a complication when you remove the parotid gland. And in these patients, they notice that whenever they're chewing, then they start hypersalivating in the region where the surgery was done. And that can, if it's not, sometimes the Frey syndrome can be non-noticeable or noticeable. So if it is non-noticeable, even the patient will not know. But if it is noticeable and visible, then we inject Botox in that area just to reduce the secretion of saliva. We can also use Botox in patients who have excessive salivation, drooling, like children with cerebral palsy, or patients who are taking antipsychotic drugs because of schizophrenia and they're drooling a lot. So then Botox is injected into the salivary glands to reduce the production of saliva. Other areas, patients who have tics, the involuntary muscle expressions, which somebody could have either because they had trauma or it's just been happening, we don't know the cause. We can inject Botox to reduce those tics in the face area. Most people have misconceptions about Botox, that it's a toxin, it's a poison. That is not it. Yes, it can be a poison, but we need high doses for it to be a poison. And it's a relatively safe drug to use. One of the side effects, it depends on the area that has been injected. You can over-inject Botox, and when you over-inject or when there's diffusion of Botox to other areas, then you'll get unwanted effects in that area. So supposing you're injecting in the forehead region and the Botox migrates into the skin tissue just where the eyes are, then you get drooping in that area. If you're injecting Botox for the larynx because of hoarseness of voice, as you inject, sometimes the patient might get, the hoarseness may become worse before it starts getting better. There's also a possibility of having difficulty in breathing that we have to explain to you, and it's good for such patients to be monitored. and if the difficulty in breathing worsens, then measures are taken to avert that. If Botox is being injected around the eye, around the mouth area, then and there's migration into the buccal mucosa, then the patient may have drooling, may have inability. When they're chewing, they have a funny sensation as they're chewing, but that doesn't last long. It can happen. It will last a few days, and then it goes away. Others are just the complications are associated with injection, such as the pain. Pain is different for the pain score is different depending on patients. So some patients may not even experience any pain at all. Others may feel a bit uncomfortable. Light-skinned patients, you might have bruising of the skin, redness of the skin where the injection has been carried out. The Botox will last for 3 months, but the effects, you start noticing the effects after the 3rd day, which will progress until the 2nd to the 3rd week when you notice maximal effects. So if you came in for either the voice or because of wrinkles or the migraines, then after 2 weeks, you come back for a review. If the client is not satisfied, then we can give additional units at that time, because then that's when we judge when there's maximal effect, and then it will last for 3 months.